Welcome to Chapter 1, Part 2 of the lecture for the Intro to Communication Disorders class. "42 million Americans, or 1 in 6, has a communication disorder. Distorted speech is speech that is defective when it is conspicuous, unintelligible, or unpleasant to the speaker or to the audience. Social values exist about communication. The speaker and the listener may feel embarrassed or have negative feelings toward the speaker. The speaker may feel frustrated, embarrassed, humiliated, or anxious. And the etiology is a study of causes of diseases and disorders. There are causes for some communication disorders, and other causes are unknown. The age of onset, for congenital disorders, it is noticed at the time of birth or soon thereafter. Some of those disorders include deafness, cleft palate, mental retardation, brain damage. An acquired disorder occurs after there has been normal communication. Some examples of an acquired disorder include stroke, stuttering, and hearing loss. Aphonia is a voice disorder where you have a total loss of voice. It can be caused by emotional trauma or paralysis. Vocal nodules are common in children and teachers. Nodes develop on vocal folds, causing breathy and harsh voice. Excessive talking and shouting can cause vocal nodules. Articulation disorder is when one or more phoneme is not produced age appropriately. You probably think back to your childhood, you can think of some people, or maybe even yourself, who has dealt with an articulation disorder. Maybe somebody had trouble saying their R's, maybe they had a lisp when they said their S's. A phonology disorder is when phonemic errors have patterns, maybe saying tutti for cookie or tat for cat. Adults may acquire motor speech disorders. Language disorders. In children, speech can be delayed by having a language disorder. Some children talk using telegraphic speech. An example of this would be go store, leaving out the smaller words in the middle of go to the store. In adults, deaf and cognitively impaired adults will have their language disorders continue to give them difficulties. Strokes interrupt the flow of blood to the brain, causing brain cells to die. Aphasia is a loss of language. Dementia is a progressive disease of the nervous system. Stuttering is an excessive number or duration of disfluencies, often containing tension and struggle. Cluttering is impaired fluency, rapid speech, possibly combined with disorganized thought. Often the speaker is unaware that they are doing this. Conductive hearing loss is when the outer or middle ear is impaired. Otitis media. When you were little, you might have had ear infections, causing you to have a mild hearing loss while you had the infection in your ear. Conductive hearing loss can be helped through medication or antibiotics. Sensorineural hearing loss is in the inner ear or the auditory nerve when it's impaired. ASHA stands for American Speech Language Hearing Association. It's the national governing body for speech language pathologists and audiologists. Speech language pathology The people in speech language pathology are referred to SLPs, or speech language pathologists. They're concerned with the study and understanding of human communication and its disorders, and the assessment and treatment of those disorders. Initials you might see after a speech language pathologist's name are CCC, SLP. This shows that you have a master's degree from an accredited program. You'll take a national certification exam and have a clinical fellowship year where you will be working under the supervision of a certified SLP. After the completion of that CFY, you will have your Cs, CCC, meaning Certificate of Clinical Competence. In audiology, you're concerned with the study and understanding of normal and disordered hearing and the rehabilitation of individuals with hearing impairments. Beginning in 2012, a doctoral degree has been the entry-level degree for audiologists. Again, you will take a national certification exam and work in a clinical fellowship year under the supervision of a certified audiologist. At the end of that time, you'll have your Cs for audiology. There are 11,000 audiologists. Over 70% of audiologists work in a healthcare facility. They also work in the school system, industries, and colleges or universities. There are 82,000 SLPs. Over 50% of SLPs work in the schools or school system. They also work in healthcare facilities, colleges and universities, and private practice. This is the end of the slideshow and lecture for Chapter 1. Thanks for listening.